lecture is about the antifungal drugs. Okay. Okay. Before we start to the different drugs that are used for fungal treatment, we should understand what are different fungal infections we have. Basically, we divide the fungal infection into two categories. One is known as superficial infection that affects the skin mucous membrane, and the other infections are the deep infection, and that basically may affect the internal organs like lung, heart, or anywhere into the body. So these are the severe sort of reaction. The superficial infection could be mainly due to two categories. One is known as dermatophytes. They basically affect the keratin layer of the skin. The example is Tinea pedis, ringworms. And the other superficial infection could be candidiasis. And this is a yeast-like infection, and it may cause oral thrush, vulvovaginitis, or male infection. So we'll go according to the treatment, according to the cause, and then we apply the different antifungal drugs. So this is a basic classification of the fungal infection. If we talk about the drugs, that what are the different drugs used for antifungal treatment? So we categorize in two ways. One way is because of the chemistry of the drugs. According to the chemistry, the drugs of antifungal could be natural, or they are known as antibiotics, and the other one is the synthetic one that we prepare in the laboratory. So the natural, that is derived from the living organism, we have the graciofulvin, Amphotericin-B, very well known drug, nystatin. They are the drugs that basically derive from the living organisms, like from plants or any bacteria. They are known as natural antifungal or antibiotics. Synthetic drugs that basically we prepare in the laboratory, and they could be azole group. In the azole group, we have the imidazoles, we have the triazoles. They are the synthetic one. They are not naturally produced, but they are actually taken from the, they are prepared in the laboratory. Another way of classification of antifungal drug is that how do you apply the drug? The drugs could be systemic. Okay, obviously you will give the drug when you find out that the infection is severe and it has reached to the different organs of the body. So in case of systemic infection, you give the drugs known as systemic drug. The drugs, they are more effective, they are more potent, and they contain the prototype drug Amphotericin-B, graciofulvin, fluconazole, and terbinafine. So you can also classify antifungal drugs according to the type of infection or how you are infusing or you're giving the drug, systemic or topical. Topical, again, applied onto the skin, and this could be ketoconazole, like imidazole group, triazoles, nystatin, gentian violet, which is now is not very much used. So you again have to remember systemic and topical one, because in the clinical setting you come across to different conditions. You find out the patient with severe infection, with systemic infection, then you have to apply the potent drugs. Okay, so this is basically up till now the classification. This is first the fungal classification, infection classification. Then we have the drug classification, natural or synthetic. Then we have classification according to the route of administration, how we are giving the drug, and this is systemic and topical. Now we come on one by one to the different drugs. We discuss the drug individually, and in this case, the first one and the prototype of drug we all know is the Amphotericin-B. Amphotericin-B, I again told you that it's an antibiotic, so it's a natural compound, and it is derived from some natural or living organism. Chemically, it's a polyene macrolide. You have known to the macrolides. You have gone through in the antibiotics. Macrolide are the antibiotics that have a specific structure, large molecular structure, like the drug like azithromycin, clarithromycin, they come into the macrolide. So this drug have a similar structure with more double or triple bond. So polyene means having more uh, unsaturated carbon. So it's a polyene macrolide, and it is pharmacokinetic is that it's poorly absorbed orally. So usually we give it by slow IV infusion. Again, Amphotericin-B is a drug of choice for systemic infection. So in severe infection or systemic infection, we give this drug. So this is absorption has some problem. So this is usually given with the IV infusion. Also nowadays we have liposomal preparation. These preparation are good way to give them orally as well. So in order to see that orally it is not absorbed from the GIT, so we have made this liposomal form. This is easily to taken, and this can be increase absorption process. This drug is highly bound to plasma protein. Okay, so plasma binding is very high. An important thing is that I've underlined that it does not cross the blood-brain barrier, but it crosses the placenta. What it comes in your mind that if not crossing the blood-brain barrier, then we have that this is not going to be effective for the brain infections. So CNS infections, other things, they are not controlled by this drug, and this is helpful in case of pregnancy or when we are targeting the newborn. So this is also, it can cross the placenta. Okay. Every drug has a specific mechanism of action since it is an antibiotic. So antibiotic, mostly you know that they are classified according to they may affect cell membrane, affect protein synthesis, or they can affect on nucleic acid. So this is a drug that affects the cell membrane of the fungus, and it binds to the cholesterol present into the cell membrane known as ergosterol, and then it causes the pore formation and leading to the leakage of the intracellular ion and macromolecules. So more or less a function similar to penicillin or like this, affecting on cell membrane and affecting on the ergos or alcohol part of the cell membrane, because you know the cell membrane is made of this ergosterol. So this affects on ergosterol, and it causes the permeability or pore formation, and that causes the leakage, potassium leak out, and then it leads to the cell death. So it basically affects on cell membrane of the fungus. This is a specific mechanism. Clinically, this is a very effective drug. It is a broad spectrum fungicidal action, means it is given in the systemic infection when you have a very severe infection. So it's a drug of choice. Drug of choice for life-threatening mycotic infection. Okay, so patient presenting with severe life-threatening and fungal infection, they are treated by Amphotericin-B. So this drug is very effective and used also for the emergency cases. Also used for chronic therapy and preventive therapy of relapse. This is also given when you have a relapse of the fungal infection. Another use of this Amphotericin-B is that in cancer patients who present with the neutropenia or low white blood cell count, who remain febrile or they have fever, this is a broad spectrum antibiotic that is given. So this is also used as a chemo in the chemotherapy as well. So drug of choice for systemic infection, life-threatening infection, relapse, and in the cancer patient to afebrile the patient. Amphotericin B can also be combined with another antifungal drug that we will discuss later on, flucytosine. There is a synergistic reaction, not the infection. There's a synergistic reaction or synergistic effects is produced when we combine amphotericin B with flucytosine. Amphotericin B basically causes leakage in the cell membrane, or it increase the permeability of the cell membrane. So this actually allows other drugs to move inside the fungus. So first work is done by the amphotericin B, that it actually causes the leakage in the cell membrane, and then this spore formation allows other drugs to move inside. Like flucytosine is then easily penetrate, and then it causes effect. So flucytosine is basically a pyrimidine antimetabolite, means that it will work on DNA and work on the basis of the DNA, and that's how it disrupts the nucleic acid protein synthesis formation. So what we have seen in a clinical setup, that there is a good combination of amphotericin B and flucytosine, and when they are given alone and when they are given in combination, they have a more effective result as some of their single treatment. This is known as synergistic effect. You know that when the individual effects are enhanced by combining the two drugs, this is known as the synergism. Every drug has a side effect or adverse effects. Its therapeutic index is low, so you have to use this carefully, especially you are giving IV, so you have to be careful about the dose. 1.5 milligram per kg per day is a conventional dose, and it may raise to 10 milligram in case of liposomal preparation. What would be the side effect if you give this amphotericin B? That it sometimes cause immediate infusion reaction. The patient may have fever, chills within 1 to 3 hours. It may go to hypotension, lowering of the blood pressure. So one could be the immediate effect. Then when you are infusing, you find out the symptom, and sometimes it also causes the slow toxicity. So this drug is most toxic to the kidney, so it's called renal toxicity. Azotemia is the increased nitrogen into the body, which is basically the function of the kidney to eliminate nitrogen from the body, is exacerbated with other nephrotoxic drugs. So you have to be careful while you are giving amphotericin B to renal compromised patient. You have to take a good history. Okay, in case of the patient renal failure or CRF, chronic renal failure, the amphotericin is not a good choice to use as a antifungal drug. Along with this, it also causes the thrombophlebitis, which is the inflammation of the veins. This could be side effect. The side effect would be immediate. The side effect would be slow toxicity. Liposomal preparation is a new form of amphotericin B, in which this amphotericin B is packaged in a lipid-associated delivery system, and that reduces the binding of human cell membrane. So reducing means this increase the specificity of the amphotericin B. What it does, that liposomal preparation, every drug when we give into our body, our target is that this, for example, if it is an antibiotic, we focus that this drug effect on the germs or the bacteria and not affecting the normal human cells. But unfortunately, we do not find more drugs such that which only affect on target, like bacteria or viruses, are not affecting the human cells. So in order to avoid this phenomena, in order to reduce this human toxicity, amphotericin B is a preparation of the liposomal preparation of amphotericin B is a way to reduce the harmful effects on human cells. So it reduces nephrotoxicity, infusion toxicity, and It is more effective but expensive. So new formulation of Amphotericin-B is a liposomal formulation, which basically reduce the side effect of this drug. Okay, so this is all about the Amphotericin-B, which is, I told you, the prototype of antifungal drug, and that is used for the emergency cases and for the severe infection. Okay. Then the second type of drug that commonly used for the fungal infection is the azole. Azole is basically due to its chemical structure. So it's a synthetic fungistatic agent. So it's not a fungicidal, it's a fungistatic agent with a broad spectrum of activity. It has antibacterial, antiprotozoal, antihelminthic, antifungal. So azole is a broad group which, along with this antifungal treatment, also given into the other problems. Azole can be divided into two groups. One is given in systemic infection, for example, the triazole group, and the other is given in the topical cutaneous infection, that is imidazole. Generally, what is the mechanism of the azole? They inhibit the fungal cytochrome P450 system. Okay, there is an enzyme known as alpha-demethylase. This enzyme basically converts Lanosterol to Ergosterol. So in the cell membrane, this compound is changed. So this conversion is basically stopped. And once this conversion is stopped, there will be delay in the formation of the cell membrane. So apart from Amphotericin-B action, which basically causes the leakage into the cell membrane, it does not allow the cell membrane to develop or to form around the cells. So it's basically an inhibitor of the cell membrane formation. Specifically, the enzyme is known as alpha-demethylase, so it affects, and then it does not allow the ergosterol to form, which ultimately form the cell membrane. The second mechanism is also seen that it inhibits the mitochondrial cytochrome oxidase, which actually lead to accumulation of peroxides, and that really causes the autodigestion of the fungus. So it affects on mitochondrial cytochrome system, and as a result, it basically increase the free radicals or free radical like peroxides, which are toxic, and this peroxide then itself causes the autodigestion of the fungus. So the increase of the peroxide is responsible for death of the microorganism. So this could be the two mechanism affecting on alpha-demethylase and does not allow to convert Lanosterol to Ergosterol, and the second way is this that affects on mitochondrial cytochrome and leading to the increased level of the peroxides. Okay, as we told that triazole is used in systemic infection. So triazole could be like fluconazole, itraconazole, voriconazole. Okay, so they are basically given in case of systemic infection. So fluconazole, itraconazole, voriconazole are the triazole, and they lack sensitivity, inhibit human gonadal steroid synthesis, testosterone, and cortisol, and they also are teratogenic in action. Okay. So we discuss one by one. First one is the fluconazole. Fluconazole is available in oral and IV dosage formulation, whereas it is water soluble, completely absorbed from the GIT and eliminated unchanged in urine. Fluconazole also penetrates well into the blood-brain barrier. So these are the drugs of choice that can be given into the CNS infection, and they are the drugs that are used for the cryptococcal meningitis. So meningitis that is caused by the fungus, the fluconazole is a drug of choice because it crosses the blood-brain barrier. This drug is also used in mucocutaneous candidiasis, and the important thing about this toxicity is that the fluconazole is toxic to the liver, and it causes the hepatotoxicity. So like for example in Amphotericin B you have to take care of the renal function, uh, whereas in case of the fluconazole you have to take care about the liver function, or you have to see the liver profile of the patient. Then the second drug from this group is the itraconazole, and this drug is different from fluconazole, that it lacks the endocrine side effects, and it has a broad spectrum activity. Its absorption is increased with the food. It's a highly lipid soluble, so it penetrates well into the tissue like bone, sputum, adipose tissue. Also, it is used in a condition like dermatophytosis, vulvovaginal candidiasis, and this drug cannot cross to the blood-brain barrier, and it also has a negative inotropic effect. Okay, so some specific conditions are there that some drugs can cross the blood-brain barrier, others cannot. So you have to see whether which type of infection we have and where they can be effect. Voriconazole is another drug, and this drug is also a broad spectrum given orally and IV, and it also have a good oral bioavailability, and it again have a good penetration into the CSF, so it is again a good drug for the CNS infection like like meningitis, because you know that the bacteria for the meningitis is present basically in the cerebrospinal fluid. It is also used for invasive aspergillosis and serious infection. So again, aspergillosis is one of a fungal infection, and it's basically a respiratory tract problem. So this is also going to be given. It causes the visual disturbance. It changes the visual acuity, but it's basically a reversible process. Once you stop the dose, then you have a problem. Okay. Okay. Then we have this is up till now. Basically, we were discussing the systemic infection. Okay, so you remember the names of the drug that are mainly given in systemic infection. If I repeat once, for the systemic and the severe infection, we have drug like Amphotericin B. But remember that Amphotericin B is not effective for the CNS, so you have to be careful. You are giving systemically, but not targeting the brain infection. Then we have the good combination of Amphotericin B with the Flucytosine. It's a synergistic combination. Then we have drug like azole, and in the azole group we are discussing first the triazole because they are affecting systemic. Then in the triazole group we discuss fluconazole, which is basically more effective in the brain infection, the cryptoconal and meningitis. Then itraconazole, this does not cross the blood-brain barrier. Negative inotropic means that it affects on the heart, and it reduces the force of contraction or heartbeat. So they have a negative effects on heart. Inotropic, you also know the drugs that increase the rate and the force of contraction. Voriconazole, and this is again for the CSF and invasive aspergillosis. So this is now up till we discuss the systemic infection. Now we are discussing with the cutaneous infection, or the infection that is superficial on affecting on the skin. For example, the Grysofulvin is a drug that is used for the cutaneous infection, and this is given for the dermatophytes. Dermatophytes, we know that these are the fungus that affects on basically the worms, ringworms on skin, hair, nails. So they are the superficial infection, very common. The ring formation on the skin or the hair and nails. So the Grysofulvin is given. The specific mechanism of action of Grysofulvin that it affects on microtubule function. So mechanism is also important. Like we are discussing the mechanism of each and every drug, like amphotericin affecting on cell membrane, The azole group is affecting on alpha-demethylase. So this is some you should also remember in one line. Chrysotoluene is a natural compound and it affects on microtubule function. Like if you can recall, the drugs like paclitaxel or vincristine or these drugs, they basically affect on microtubules. So this belongs to one of these class. Chrysotoluene is very effective in athlete foods. Athlete foot is a clinical condition. The athletes, they face this problem, the infection of the fungus in the foot. So this is a good drug of choice for this. Adverse effect, we all know that it causes peripheral neuritis, mental. This happens when it has a systemic absorption. Okay, the wound is so bad that it has disrupt the lining of the skin and has absorbed into the bloodstream, and then it may cause. So this is in the case of higher doses or when the wound is very bad and it has a systemic absorption. This is contraindicated in pregnancy and porphyria. Okay, then the imidazole group, they are the group that is given for cutaneous infection. And we have the imidazole group like ketoconazole, very well known drug, miconazole, and clotrimazole. So they are the drugs that are given for the skin infection or cutaneous infection. So we discuss one by one. Ketoconazole it is well absorbed in orally. Its bioavailability decreased with antacids. Proton pump means this drug should not be given with any problem with the GIT like H2 blocker, PPI, and others. Half-life increase with the dose. I mean, when you increase the dose, the half-life increase. Does not cross blood. This is basically a cutaneous, superficial infection, so there is no need to cross the blood-brain barrier. Clinical use we give in oral and vaginal candidiasis and dermatophytosis. This is its clinical use. Okay, another topical drug is nystatin. Nystatin is very much similar to the chemical structure of the amphotericin, very potent drug. Polyene, macrolide, similar structure and mechanism, but its toxicity is very high, too toxic for systemic use. So we only use it topically. The nystatin is equivalent in potency with the Amphotericin B, but because of its toxicity, it is not used systemically, but it is used for topically. It is available as creams, ointments, suppositories, and it's not absorbed from the skin and mucous membrane from the GIT. It is used for the superficial candidiasis, vaginal candidiasis, and the other combinations. Right. It also used given in the combination of corticosteroid. You find out many creams in the market which has a combination of steroid as well as nystatin. Clotrimazole is also a very well-known drug, and this is present in the cream form, lotion form, 0.5%, and it is given for the in female with a vaginal infection, vulvovaginal candidiasis, and it may cause some reaction like edema, urticaria, and other sensations. So again, this is the topical. We have nystatin, clotrimazole. In the cutaneous, we have ketoconazole. So you all have to remember it. Another group of antifungal drug is squalene epoxidase inhibitor. Okay, so they are the new drugs into the market, and they basically inhibit an enzyme known as squalene epoxidase, and this enzyme is basically again involved in the synthesis of ergosterol. So most of the drug they are affecting on cell membrane, and they are somehow affecting the formation of the cell membrane of the fungus. The drug in this is tolnaftate, you may rightly pronounce, used in tinea pedis. This is used as cream against a topical infection, and this is a good cream to apply for different tinea infections. Then we have neftifine, and this is again broad spectrum fungicidal drug. This is available as cream or gel, and it is a good treatment of tinea curaris. Now you have to remember the different skin infection that you discuss in the dermatology. And we have terbinafine, and this is a drug of choice for treating dermatophytosis, dermatophytes like onychomycosis. This is a nail infection, onychomycosis, and it is better tolerated with a shorter duration. So they are the new drugs that used for the topical drug, and this is the squalene epoxidase inhibitor. I thought probably that is the yes, that is the last slide. So you remember different names, their systemic or topical use, and what are the different conditions in which we use it. I just repeat for a moment to have the names of all the drugs. Like we discussed today, the Amphotericin-B, the prototype drug. Then we discuss its combination with flucytosine, synergistic effect. Then we discuss it is present in liposomal form, which basically reduce its toxicity. Nephrotoxicity is more evident with this Amphotericin B. So this preparation basically reduce these nephrotoxic effects. Then we discussed today azoles, and azoles, they are basically synthetic compound, and they can be triazole, imidazoles. They have a specific mechanism, and then we have the different triazole, fluconazole, itraconazole. We discussed they are basically used for the CNS infection, cryptococcal meningitis, itraconazole, voriconazole. And then we discussed the cutaneous and the topical infection, which we have gasophilin is a drug of choice for athlete's foot. And then we have imidazole like ketoconazole, miconazole, clotrimazole, and nystatin is very much similar to a fungal treatment, amphotericin B, and then we discuss finally the squalene epoxidase inhibitor. They are the new drugs. Okay, now the session is open for any question if you want to ask. I'm here to give you answer. Yes, this is a question previously asked. What is negative inotropic effect? So I just told you that negative inotropic are the drugs that basically affects on heart. They reduce the basically the function of the heart or the strength of the heart. They are known as negative inotropic drugs. Uh, there's a question that, sir, would we discuss capsifungin? No, I didn't mention in this. We basically focus on the main prototype of the fungal drugs that is present. Capsifungin we will not discuss. Okay. Okay. The other question from the azoles, ketoconazole is used for cutaneous infection, while the three other used for systemic infection. Yes, fluconazole, itraconazole, they are basically uh, triazole group, so they are given for systemic infection. Okay, so not more question I see here. So uh, the fungus drugs, different drugs, you have to remember the names and their specific mechanism and what type of systemic infection you are basically using. So I'm waiting for further 4 or 5 minutes. If you have any more questions, you can ask. Okay. The question is, how does ketoconazole decrease testosterone? Okay, basically ketoconazole uh, affects to the metabolism of this hormones like testosterone and cortisol. So it's one of the every drug has a different actions. So this drug basically affects on the synthesis of or the metabolism of the testosterone. So this is how it affects onto the hormonal level. Corticosteroid and estrogen, they all have a similar sort of structure, and ketoconazole also have effects on this type of growth. So this is why they said that it affects on testosterone and corticosteroid.